Hey everybody, Dr. Schultz with another weekly update from the Centeno-Schultz Clinic. Thank you for checking in. We're going to continue the thoracic spine series. And today what we're talking about is the 9 most common causes of back pain near the ribs. So thanks for checking in and let's get started. So the back pain that I'm talking about is along the spine here and here. And it can actually be quite debilitating. Now, the thoracic spine is unique in that the ribs at each level articulate or form joints along the spine, and that can contribute to significant pain. So let's go through the 9 most common causes. Number 1 is a muscle strain. The thoracic spine is rich in both small and big muscles. These muscles can be strained, they can be stretched, or even torn, resulting in back pain in the ribs. Second, my gosh, everyone's on their computer or their iPhone, so poor posture can significantly contribute to overloading of the thoracic spine and the joints, leading to pain. Number 3, ligaments. Ligaments can actually be injured. They are the duct tape that hold bone to bone, and they actually, like the muscles, can be injured. So you can have a ligamental sprain, and as a result have pain in the thoracic spine and ribs. Number 4, a joint injury. Now there are 3 joints in the thoracic spine, and I'll show you here. So the first one is a thoracic facet, and that's this joint here. The second one is the costotransverse, and that's basically, the costotransverse, and that's where the rib head articulates or joins the transverse process of the spine, and as a result in meeting that forms a joint called the costotransverse. The third is, as the continuation of the rib head, it forms a joint where it attaches to the vertebral body. Hence it's called the costovertebral joint. Any and all of these joints can be a source of significant pain and should be questioned or interrogated by your provider. Number 5, organ dysfunction. Unlike the cervical spine and the lumbar spine, the thoracic cavity is actually rich in many vital organs, and that includes the lungs, the heart, the liver, the gallbladder, and the spleen. All these can be diseased, injured, and cause subsequent pain, and they need to be evaluated. Number 6, infection. Infection can be involved into the muscles, the skin, the bone, the spine, or any of the organs. So always think about infection as a possible cause of back pain in the ribs. And I forgot to put in kidney. If you've ever had a kidney stone or kidney infection, you can have flank pain. Next is osteoarthritis. Number 7, common cause of back pain in the ribs. Osteoarthritis is the most common cause. That's kind of a wear and tear arthritis, and that's depicted here in the X-ray. Next is scoliosis, basically an abnormal curve of the spine, as you can see here. And this abnormality in the curve puts a lot of additional forces on both the disc and the facet joints and those 3 joints we talked about in the thoracic spine, the thoracic facet, the costotransverse, and the costovertebral joint, all of which can cause pain. Number 9, fibromyalgia, really a chronic debilitating condition with widespread pain, stiffness, and tenderness. Treatment options. Treatment options for back pain in the ribs. When appropriate, conservative therapy should always be the first line of treatment. And that would include rest, heat, ice, improvement of your posture, medications, some non-steroidal, some safe anti-inflammatory medications like fish oil and turmeric, and then chiropractic care. So the take home for this, and thank you so much for checking in, is the diagnosis is key. You've got to get an accurate diagnosis of where your back / rib pain is coming from. And all the possible sources really need to be evaluated. Has your doctor, if you or a loved one have ongoing pain, have they talked to you about costotransverse joint? Have they talked to you about a thoracic facet? All these should be evaluated so you can get the very best treatment plan. In addition, an ultrasound examination is key to see if there's inherent instability as a result of a ligament injury, either a sprain or a tear. At the Centeno-Schultz Clinic, we are experts in the evaluation and the treatment of thoracic pain. If you or a loved one have this and haven't gotten traction from conservative care, consider a consultation. Thanks so much for your time. I'll see you next week.